Since 1976, the case Estelle v. Gamble finally gave way for inmates to receive proper health care, but this gave way for an unfortunate precedent called deliberate indifference affecting the standard of care. This idea of deliberate indifference is prison doctors in their response to prisoners' needs or by prison guards intentionally denying or delaying access to medical care. Well, this was an amazing thing that happened and has led to many consequences later down the road, and is one of the leading causes for improper care of medical conditions. First, let us spread out. Medical care for inmates is a popular topic to discuss, but many of those discussions still leave a lot on the table. Diving deeper into the actual care that an inmate will receive from their medical condition will make that discussion easier. These conditions can range from STDs, viruses, or physical injury. While the standard of care has been better, there are still holes in this incomplete system. It is clear as day that the U.S. prison system does not provide sufficient medical care, which in return leads to death, diseases, and the worsening conditions of inmates. Going back to deliberate indifference, this has played a role in the treatment of hepatitis C. The court case Atkins v. Parker further proves this. It follows an issue with how the prison took care of only the ones who were in critical condition. It left other inmates whose conditions will continue to become worse to be ignored. This was made clear with the judge saying the medical director was obviously aware of the risk of death from hepatitis C because he has seen 81 inmates die. There's a blatant disregard for medical care for all inmates who had the same illness. Another similar case happened a year after, Woodcock v. Correct Care Solutions. It was the same idea and plan of only screening ones whose condition were critical. Both these cases had issues with costs, which in return allowed them to use deliberate indifference. Since they did provide care, it was the cost that led them to not treat everyone. But the thing is, treating them then and there is ultimately cost-effective and could prevent 4,200 to 11,700 liver deaths and 300 to 900 liver transplants. So while the screening is expensive, the effects is much more staggering and all around more sad. On top of that, prison can be an ideal environment to provide hepatitis C treatment. Having a huge group of people to be cured creates less issues in the prison and outside once released. It can lead to a decline of spread in the prisons, which in return lowers the cost of medical treatment. But it is strange how the prisons can deny basic medical care because of deliberate indifference. It gives them the right 2 cents they'd rather not spend the money at the time. And this is just one part of the messed up system. It's a theme that follows so many people. One man by the name of Deonta Green was a victim of deliberate indifference. He was a man already struggled with addiction issues and having a valid prescription for Suboxone, a medication critical for managing his withdrawal symptoms. Medical staff knew of this and failed to act on it. Deonta started to have withdrawal issues. It was not until he collapsed in his bed for medical staff to send him to the hospital. Deonta's issue also highlights some of the issues with contracting out their medical care. And a 2020 Reuters report also revealed that when U.S. jails contract out their medical care, fatality rates are higher. Having both staff and the supplier fail its duties is unacceptable in the modern standard of medical treatment. Deonta is not even a lone case. There are countless instances of this same issue, all while nothing has changed in the prison system. Now, BOP, or the Bureau of Prisons, being one of the biggest consequences when it comes to inmate care. Their health services statement says delivering necessary health care to the people in the BOP custody, in accordance with proven standards of care without compromising public safety concerns inherent to the BOP's overall mission. And think that they cannot even deliver on their own statement. It is embarrassing. They even had a pattern of hiring physician assistants who lacked proper qualifications and supervision. Just imagine you are in the medical bed, dying, experiencing the worst pain and suffering, while the assistant physician is standing there like a deer in headlights with no idea what the next step is. This is not even a joke. The GAO found that 34 of the 66 physician assistants working for the BOP at the FMCS at the time had not graduated from the programs approved by the American Medical Association. Imagine you go into surgery for life-saving treatment and the last thing you hear is a physician assistant pulling up a YouTube video on what they need to do. At that moment, you think it is over. And it was not even just assistants, that nearly half of the BOP's medical providers were operating with little to no oversight. And it's not like this was an issue for some time, no. This has been an ongoing issue from the 1980s and still a horrible institution in the 2024. A total of 4,950 people have died in the federal custody over the last decade. While it is expected that inmates will die, so many of them died due to the lack of care they did not did or had not received. And this is just the tip of the iceberg of BOP. I can make an entire separate video just talking about the BOP prison. Now, focusing on HIV, it is a scary and horrible disease that plagues the US prison system. Having no cure and having to be stuck on meds to stop the progression into AIDS is very scary. You think that prison system would take a disease that has a makeup of 1.5% of the prison population since 2010 and only continues to increase, prisons would be serious about HIV. But it seems to be the quite opposite in many cases. From the start of the 1980s AIDS epidemic, prisons implemented severe policies like segregation. It was a sad and terrible time to be in, with little knowledge and fear of HIV. It restored it to an inhumane idea compared to the now modern standard. But even in this modern standard, people who have HIV do not receive adequate medical care for something so serious. Like hepatitis C, it also stems from the idea of deliberate indifference and cost, of severe shortages of medication caused by prohibitive cost in providing medication. It leads to only 1/3 of eligible patients consistently receive medical treatment. Being an inmate where day by day there is a fear that your body's immune system just cannot fight, and you succumb to a common cold because the prison did not want to spend the money. This then plays right back in deliberate indifference, since due to the lack of subject intent to harm on the part of the prison's administration. Since the prison can use the excuse of lack of medication, which in return negatively affects the inmates with HIV. It makes a conundrum of what the prisons is doing, since the court only sees it as malpractice, which is not under deliberate indifference. There is a clear issue, but there's not enough evidence to back these claims since it falls under another issue. A prison is able to save money due to deliberate indifference, even at the cost of an inmate's health and death falling. These ideas clearly bring the idea that these prisons know what they're doing and continue to do so. Finally, let us talk about co-payment in prison, which simply means inmates have to give a certain amount of money to be seen by a medical physician. It already seems like a weird idea, since prison wages typically range from 4 cents to 40 cents per hour, and these co-payment can range from meeting a $2 to $8 co-payment in prisons requires as many hours of wages as a co-payment of $69 to $1,090 in the community. So having pre-existing condition, you are now subjugated to work to get some sort of medical treatment. It's a backwards idea that inmates need to pay to see doctors while they should be covered. This can become even worse with issues like the U.S. Center of Disease Control and Prevention investigators conclude that co-payments, alongside with poor access to soap, contributed to several prison outbreaks with methicillin-resistant streptococcus infection. These inmates had nowhere to go since they make so little from the work, and also that many can't even work. Many of these inmates don't even bother with the illness since they don't have that kind of money. Imagine being an inmate and you make 75 cents a day working in the kitchen or making uniforms or license plates. 75 cents, so that's 4 days worth of work to be able to see a physician for the enema you just started. These inmates' conditions have become worse under the co-payment system the prison has set up, and nothing has been done. It makes the inmates have to willingly put aside their health due to money issues. It's a sad situation between health and necessary goods. It is like the prison has its own monopoly and can set what they want in the inmates' world. But so little has been done to combat these issues. It continues to grow and grow as more and more inmates get denied critical care. The U.S. prison system does not come to the standard of what needs to be done for these inmates. It leads to question just how bad it can get for these inmates if this continues.